Sadly, possibly in our dental setting, one of our patients may have a stroke. The first signs of stroke include sudden weakness or numbness of the face, arm and or leg, especially on one side of the body. Sudden blurred or loss of vision in one or both eyes. This is what happened to me of one of my patients sitting in the reception room. She yelled out, and there was no receptionist at the time or front desk person, and she yelled out, "Margaret, Margaret, I cannot see." And again, it was in both eyes. Sudden difficulty speaking or understanding what others are saying. She did have that a little bit too. But then I use FAST to remember the warning signs of a stroke. We'll compare these during the webinar with Bell palsy. Again, that would be a different type of facial paralysis. But we're going to look at the whole body here also. First, ask the person to smile. Does one side of the face droop? Arms. Ask the person to raise both arms. Does one drift downward? Speech. Ask the person to repeat a simple phrase. Is their speech slurred or strange? Listen to that too. Time. If you observe any of these signs, call 911 immediately. Don't wait for any kind of opinions or anything like that. Make sure you do call that. What we're going to see is that, again, people experience a stroke often experience the same symptoms associated with Bell palsy. However, stroke usually causes additional symptoms not seen with Bell palsy. We'll see once again more with the rest of the body possibly. Now, changes in level of consciousness, that doesn't happen with Bell palsy. Confusion, dizziness, loss of coordination, seizures can happen also, change in vision. We'll see that again. That's my patient yelled it out. It was so overwhelming for me, but you know what? You go right into the mode. I was a first responder again in the past, and you go into that mode, so do not worry again, and assure again your student population, if you are an instructor, that they will be able to do this. You've got the information to be able to do it. And again, the weakness in the arms or legs on one side of the body are very, very important. Oftentimes, people experiencing a stroke will still have the ability to blink and move their foreheads on the affected side. This is not the case with Bell palsy, and as I said, we'll go over that in the webinar. So again, the ability to blink, move their foreheads on the affected side. Well, maybe not if they've had a lot of Botox. Since sometimes it's hard to distinguish between a stroke or other cause of facial paralysis, it's a good idea to go 911 as quickly as possible and let them determine what's happening. Early warning signs of Bell palsy, again, early treatment, not a bad thing. So if one is experiencing a stroke in your office or dental setting, call 911 and make a difference. But remember, the warning signs of FAST are very, very important to share again with your students. I'll include this figure right here, again, the FAST ones, in our Facebook page. What's the Facebook page about? It's just a page with a lot of information. So if you're not regularly on Facebook, again, just use your school's Facebook, or a couple people did sign up their cat or dog. We're not worried. We're not going to share anything. It's all privacy all the way. It was just a way, again, for us to share such things as this. Everyone have a wonderful day, and we'll get back to our webinars.